vision of the body. So, for example, like you've got two diagrams here. One, I think one is of a cat or no, it looks like a dog. But you can see they kind of live up closer to the spine area in the lumbar part. And you can see them there, and they're connected to, there's two ureters that go down into the bladder, all right, where the urine pools, and then the urine comes from the bladder through the urethra outside. Yes. So just some basic information there. So I just put a little note there because I didn't want to be technically incorrect, but obviously we should have 2 kidneys, but we can survive with 1. So I have no idea if it's normal for potentially animals to be born with 1, if that's unheard of, or it can happen, or maybe one that's shriveled up and doesn't do anything, and yeah. But we need 1, so it's a vital organ, so we cannot live without kidneys, and they do some pretty awesome stuff. It's part of the urogenital system, so like I was saying before, you could see how it was connected to the ureters to the bladder. And the actual important part of the kidney is the nephron, which is, I guess, the active part of, there's lots of different parts of the kidney, which I'll go through briefly in a second. But the nephron is where all the important stuff, basically where the absorption and reabsorption of nutrients occurs. And that's the part that if it dies, and it never comes back. And that's what when we diagnose patients with kidney disease, and we say, for example, with chronic renal failure, if they've lost 75% of their functional parts of the kidney, you're talking about the nephron. All right? Okay, so what does it do? So kidneys do all sorts of stuff, but the main important parts, as I said before, is they absorb and reabsorb nutrients. So basically what happens is, I guess blood comes into the kidney here, so you can see the renal artery here and the renal vein. And then this is the cortex around the outside, which I'm 99% sure contains the nephrons. Or is it just before the cortex? It's towards the outside of the kidney area.
Yeah, well, because you've got, with your nephrons, you've got the glomerulus, and then it drops down.
Okay, yeah. I tried to find a little diagram that's a little bit more, shows you, I think maybe it was on the other page, we can go back to that if we need to. But basically it goes in there, and then it goes through the system whereby it absorbs and reabsorbs what it needs based on what's going on in the body, all right? So, for example, with kidney disease, with water, for example, so we obviously don't want to be excreting more water than we have to keep ourselves hydrated. So obviously the kidney will try and reabsorb water so that it doesn't need to drink more. They try and conserve what it's got. Other parts, such as, I think most of us know about the creatinine and the blood urea nitrogen. Yep. So the kidney is involved in trying to take as much of that out of the blood as possible and excrete it through urine. Other parts, so like your potassium goes through there, salt, sodium chloride, and I'm missing one other one, I think. There's a few, it does heaps of stuff, but the main ones that come up, for example, in the blood tests is...
Oh, yeah, phosphate.
Phosphate, maybe? Yeah. Yeah.
That's fairly important with chronic kidney disease.
Yeah. Yeah. So when kidneys aren't working properly, their ability to reabsorb and absorb these things is impaired. So when we're diagnosing kidney disease, that's why the vets take a blood sample, and then they can see on the blood urea, nitrogen and the creatinine whether they're increased, and that gives us an indication that there might be some kidney impairment happening. Then you also see elevations in potassium and phosphate as well, because as I mentioned before, they're other things that normally they should be pretty good at trying to get rid of through the urine, but if they're not able to, they will go back into the bloodstream. Alright?
You can sometimes get decreases as well, so in some cats with chronic kidney disease, they'll have low potassium levels because it's not being reabsorbed.
It's hypokalemia.
Yeah.
Oh, okay.
Because, sometimes it's, because you've got to have that excretion but also reabsorption as well.
Okay, there you go. So it can be either way. The other thing, oops, is there a quick way of going back?
No, up, okay. Just press that slideshow button again. It'll go back to the beginning no matter what slide you go to.
Oh, will it?
Yeah. So go to the slideshow button again and then press the space bar. Oh.
Huh. Maybe not.
That never happened.
Where was I?
She doesn't
guess animals can come in and they can have acute renal failure, or they can have chronic renal failure, or they can have chronic renal failure and they've had like a renal crisis, so something's happened to them obviously they're sort of teetering on the edge, they've already lost active nephrons, so they're at a higher risk of having a renal crisis, so to speak. And there can also be different causes with renal disease. So you can have, they're classified as pre-renal, renal and post-renal. So does anyone know, without looking, how to describe pre-renal? Or no? Like pre-renal, renal and post-renal.
Well, pre-renal, you can, it can be reversed, I'm pretty sure.
Yeah, yeah.
So if you treat it early enough, so if it's like a toxicity or something, you can treat it early enough to be able to kind of like fix the problem, but not obviously completely.
Pre-renal, like the accidental.
Yeah, so it's kind of like it generally the definition that I have found of pre-renal are things that occur before the kidney. So for example, like Jess was saying, like if it's a toxicity, if the dog's had like a nephrotoxic drug, like an ibuprofen, for example, it's gone into the cupboard.
That wouldn't really be pre-renal.
Wouldn't it?
No, because that involves the kidney. So,
Okay.
so pre-renal is things that cause an increase in urea and creatinine that are happening before the blood.
Like dehydration.
That's the heart and the circulation, so you get dehydration.
Okay. Alright. Okay, I always thought, because like when you think of it like pre-renal, they're having the medication, then eventually it's not happening in the kidney itself, but they've ingested it and then it eventually affects the kidney. That's how.
Yeah, but if it causes damage to the kidney,
Then
that's where you're getting your urea and creatinine being elevated.
So it's renal.
Yeah, that's renal.
Cool.
So pre-renal is increases in, so it's sort of where you're getting less blood to the kidneys, and that's why you're getting increases in urea and creatinine.
Okay.
So before you get to that filtering point in the kidney.
Okay, so dehydration is probably the best example that we would
Yeah,
see.
there's not a lot of pre-renal,
Yeah.
so it's mainly dehydration.
Cool. There you go.
That
So
would determine
dehydration. There you go. It's probably the main thing. So.
urine sample.
And then the next one is renal. So that one's a little bit easier. So that's what I was saying before, I'll give you a bit of a clue. So like when you're looking at sort of classifying if it's pre-renal, renal or post-renal, my understanding is if there happens something that happens before the kidney, it's not actually the kidney itself where the problem is, but it's something that ends up affecting the kidney essentially. Yeah? Is that a way of describing it?
Yeah.
Yeah?
I mean, yeah, so I mean anything that's happening within the kidney.
Yeah.
So yeah, if you've got a toxin that's affecting the kidney, if you've got chronic kidney disease.
Yeah. Yeah. Maybe I'll think of a better example and I'll send it out in a like letter thing after this. But with renal, that's an obvious one. So does anyone have any guesses of what could be a cause of renal? So something that's, if the other one was dehydration, for example, so it...
Like you said, toxins.
Yeah?
Over ingestion, of minerals like phosphorus.
Yeah, I guess that would potentially dietary increases.
Does nutrition have a lot to do with kidney disease?
Yeah, but I'd say if you had, like if you've got a healthy kidney and you have too much phosphorus, you probably filter it out pretty able to deal with it. But ethylene glycol toxicity, snake bites, they can cause like blood clots to the kidney as well that damage the renal cells and cause ischemia, chronic kidney disease, infectious
Does everyone know what ischemia is?
in the kidneys.
No?
What was it, ischemia?
Is it ischemia is when there's a constriction of a blood vessels, or like you can't get
Well, it's
oxygen
like
to
blood
muscles and cells?
supply, yeah.
Blood supply? Yeah.
Yeah.
Yeah. So if you, like, for example, put a hair tie around your pinky finger too tight, you know what I mean? It's just like the same thing. What I'm getting at is, like, for example, something that's occurring within the kidney, in this case, like cancer, like if there's a tumour or something. I think common, like you can get nephritis, for example, so inflammation of the kidney, neoplasia, so cancer, and I think there's one that's really common, like polycystic kidney disease,
Yes.
where the kidney looks like really kind of like a, I should say like a blackberry. It's kind of like little bumps. Yeah, lots of cysts everywhere all over it. So that sort of stuff. So it occurs within the kidney. And then post-renal occurring after the kidney. So I put an example there already, but like urinary obstruction would be one, because it's post-renal because it's not it's happening after the kidney, so it's happening within the ureters or the urethra or the bladder or something like that. But it's affecting the kidney. All right. So when the vets are, I guess, working at a diagnosis, so if we ever on the phone and we're getting clients ring up, like some of the things you might hear for the history is that they might be flat, lethargic. The reason for that is that with kidney disease, if they're unable to get rid of those toxic chemicals in their blood, it makes them feel pretty average. They might be a bit dehydrated as well, drinking a lot, urinating a lot. Also anorexic, so maybe not eating as much food because again they're not feeling well. They can be vomiting, again because they feel like crap because of those chemicals in their body that they're not able to get rid of. So the tests that the vets normally do, obviously it's an age thing, so acute renal failure can happen to any animal if they eat something they shouldn't, or it's just an unfortunate thing. It can happen to any pet, but with chronic renal failure, generally speaking, we know that the kidneys should be working fine, but as they get older, we would expect the kidneys, as we say to clients when we do paranephrotic blood tests for older pets, we would expect that they're not working at the same level that they once were. So obviously over time it can progress until you see these signs as well. So the vets will often want to do like blood tests. So the one that's particularly for them interesting, as I said, the blood urea nitrogen and the creatinine. So that's on the biochemistry, as well as your electrolytes like your potassium, phosphate, those kind of things as well. And then of course you can do an ultrasound. So like I was saying before with the renal, if there was like a tumour or something like, I don't know, can you see polycystic kidney disease on ultrasound? Can you diagnose that? Yeah, so you could maybe find out a cause that way. X-rays, I'm not quite sure if they're any use.
You might see some loop-shaped kidneys.
Yeah,
that's about it.
I mean, the other thing with X-rays is often you can see uroliths, so your kidney stones.
Yeah, so for your
stones, and so
post-renal issues.
Yeah, so that's something that we can potentially do.
Yeah.
If you do a X-ray, you can also see if the kidneys are bigger or smaller than they should be. And in polycystic kidney disease, they're probably going to be bigger a lot of the time. You can see if you've got two kidneys or just one kidney.
Yeah.
You can see the bladder and things.
Yeah.
So you can definitely get useful information.
Definitely.
Right.
Yeah, so we might do that. And then of course, I guess with the history as well, if it's like a post-renal cat, if there's a cat that's got an obstruction where it's either not urinating as much or not at all, versus a cat that is urinating freely, no problems, so then I guess that sort of information will give the vet an indication as to whether we're looking at a urinary obstruction, because that's pretty serious, especially it's more common in male cats, so we'd want to deal with that sooner rather than later, versus whether it's just like a chronic renal cat that's just, for the last couple of months has been drinking more. So I guess in terms of urgency, you've got the history where the vets will sort of decide at that point. And then the last one is urinalysis. So the urinalysis, so definitely the urine concentration, which I think we all know do you know what tool we use to measure the urine concentration? Or
That one, I don't know the name of it.
the
R.
The ringing bells?
No,
The refractometer.
Okay.
Yeah. So
The refractometer.
the refractometer, as it's now affectionately named. Yeah. So
Love it.
that obviously gives an indication as to whether the urine's being concentrated. So you can look at urine and get a visual idea as well, but to get an actual number, you can do the urine concentration with the refractometer. And then I don't remember off the top of my head what the normal range is, but I have a feeling
10.08.
like 1.000 is pretty low concentrated.
10.08 is
Like pure water.
Yeah, it's really, Is it to
Yeah,
1.030?
So 1 point, so 10.0 to like 10.08 is like crank-oxygenuric, so
Yep.
that's more dilute than the syrup.
Yep.
10.1008 to 10.12 or 1.008 to 1.012
Is
the
isostonuric?
isostonuric,
Yeah.
so similar to the plasma concentration.
Yep.
In cats, you normally want it to be over like 10.35 and in dogs about 10.30.
Yep.
If you've got like a USG higher than that, or like quite a lot higher, so that's how
Dehydration.
you can determine that it's pre-renal, because the kidneys are trying to conserve water
Yeah.
and they're concentrating it
Yeah. Yeah.
as much as they can.
Yeah, which is why you're not seeing as much of those blood urea, nitrogen, creatinine. You're seeing more in the bloodstream because there's less that they're trying to save all the water for the body rather than putting it out with all that.
Yeah.
Yep, cool. So common causes, so loss of functional nephrons. So again, that's the important part of the kidney. I mean, obviously every part has an important part to play, but the nephrons are the most important. Poisoning, so ethylene glycols, Lindsay said, which is yeah, thank you.
So we probably wouldn't see that.
Do we not have that here?
Well, we don't, because we don't get like snow and people.
Yeah,
I think you put
true.
it in pie engines when you have snow. I don't know.
I should be able to probably know. Poisoning, yep. So other things like ibuprofen, eating medications, those kind of things.
Grapes and raisins. In
Grapes
dogs,
and raisins, yeah, which is a bit idiopathic apparently, because some dogs eat it their whole lives and never have a problem. Other dogs eat too and then they get acute renal issues. So that's an interesting one. Urinary obstruction we talked about. Trauma, I think I meant like as in like if they've been hit by a car or something, and I guess you can hurt a kidney that way as well, and then get rid of the nephrons that way as well. Hypertension and hypotension. So hypotension, for example, I think we all know there's something we do during anaesthetic all the time. We monitor the blood pressure. And why is it important during anaesthetic that we maintain the mean arterial pressure at a certain level? Anyone want to have in regards to the kidneys?
Hydration.
Yeah. Of course, yeah, but and when you've got, obviously with the hydration, when we're putting intravenous fluid therapy into the body, when it comes to blood pressure, there's not much we can do to increase blood pressure.
Vasodilation.
Yeah, because if there's vasodilation occurring, we can increase blood volume by putting intravenous fluid therapies into the system, but we can't. There are other factors that affect blood pressure, such as like the actual structure of the veins themselves. Like some animals might have a stronger wall than others, and then so when the pressure's going on them, it might be weaker than others. We can't change that. That's just individual patients, but we can put extra volume into the patient, which would increase blood pressure if that is a potential cause of low blood pressure in the first place. You know what I mean?
The main reason why I put hypertension was for the anaesthesia if your patient's deep and they're going into renal failure from the anaesthesia.
Exactly.
Like that.
So that's how we fix it, by increasing the perfusion. So if you've got more fluid going into the body, into the veins, then that's going to increase perfusion to vital organs because it's increasing blood volume and hopefully the blood pressure, and then that will go to the kidneys and help it deal with the insult of anaesthetic, for example.